As the coronavirus epidemic continues to spread globally, we talk with an expert to clear up any confusion about what coronavirus is.
I'm Keith Leach, and I'm here live in Koreatown to tell you about how a coronavirus scare is affecting the businesses here.
I'm Chace Beech.
And I'm Brogan Kroener. See It Live starts now.
The coronavirus, also known as COVID-19, continues to spread as the number of those infected continues to increase.
Here's the latest on coronavirus from the World Health Organization. The virus has reached 48 countries, infecting more than 82,000 people. Globally, 2,804 have died as a result of the outbreak. In the United States, there are currently 60 cases confirmed and no deaths so far.
Fear and anxiety about coronavirus is spreading as confirmed cases continue to rise. Still, there is a lot of confusion about the virus. We spoke with a doctor at USC's Keck School of Medicine to get the facts. Our first question, how is coronavirus transmitted?
When you sneeze or you cough, right, that the virus is stuck in those little speckles of saliva that go out. And that's primarily how we think it's transmitted, although we don't know if it's also transmitted by contact or other means. But what that means is that it's really easy for somebody to be infected.
Who is vulnerable?
The most vulnerable are the ones we have to worry about. So children, because some of them lack fully developed immune systems, so they have a harder time, fighting disease. The elderly, because their immune system, because they're elderly, their immune system isn't working quite as well.
Is it okay to travel to places where there has been an outbreak of coronavirus?
Obviously, try not to. If you have to go, you have to go. But there are some things, I know some people make these decisions like, well, this seems absolutely necessary to go, when in fact, probably it isn't.
What part of the body does coronavirus attack?
The respiratory tract primarily, and the lower respiratory tract, whereas like influenza tends to be more upper respiratory.
What is the mortality rate?
The early data suggests that the mortality rate for coronavirus is hovering somewhere around 2%, whereas with influenza, your typical influenza alpha, even though there are millions of cases in the United States, for example, the mortality rate is less than 1%.
President Trump said the vaccine is coming along really well. Is that accurate?
I've heard there are 4 companies that are developing vaccines. This is just the first one that's been announced. There are a couple others. They'll have to be tested and we'll see if they work. They may not work. So, for him to say there's a vaccine, yes, there is. We just don't know how good it is.
How concerned should we be?
The potential for really bad things is there. We're not heading into World War Z or anything. I don't. Not even China's at that point yet. But I think we do have to be cautious, and I think health officials saying that is not to try to scare people, but I think they're being realistic.
The largest coronavirus outbreak outside of China is now in South Korea, with over 2,000 cases reported. Reporter Keith Leach is in LA's Koreatown talking to residents about the effect the outbreak is having on local businesses. Keith?
Thanks, Chace. Right now I'm in front of Hanbok, a popular Koreatown staple that's known for its traditional Korean oxtail soup. Usually it would be popping on the Thursday night like this, but right now the lobby is almost completely empty due to a coronavirus scare that is rocking this community. Koreatown's businesses have experienced a sharp drop in patrons following reports of a flight attendant infected with the virus visiting their stores. We went to popular ice cream shop Somi Somi to talk to workers about the changes.
It affects the business a lot because people are scared of coming and just eating there in general.
Business has been really slow. Sales have been down. I've been checking throughout, basically since the rumor came out. It's been really slow. I think every business in Koreatown has been affected by it. There's multiple spots that we go to personally, like Hanbok and Agashi Gopchang. They've slowed down or closed down for a while.
Now, while some people are still too scared to come down to Koreatown, I spoke to a few patrons who are not letting a little coronavirus scare get in between them and some good food. And with the way that Hanbok smells, I think I'm going to follow their lead. Back to you, Brogan.
Thanks, Keith. Coronavirus is beginning to impact local tourism. Annenberg Media's Genevieve Glass went to Hollywood to see how businesses are dealing with the virus.
Businesses in Hollywood are concerned about how the coronavirus will impact tourism.
If it doesn't stop next 1 month or next 2 months, that will heavily affect us in summertime because summer is our main business season. So if that is happen, that we will have to suffer whole year.
I think there's been a decrease. People are running around with the masks, and it's kind of affecting the stock market, and it's definitely affected tourism.
And their fears may be warranted. An economic expert says COVID-19 will likely impact the local economy.
Imports from China that go through the twin ports at the Port of Area and Port Long Beach has already reduced by 25%. This will greatly affect, the economy of the global economy and economy of the other countries. The decline of inbound travels and, people, international travelers to local places, I would definitely say we will see, decline of incoming tourists.
But right now, there are plenty of tourists taking their walk of fame along Hollywood Boulevard. For Annenberg Media, I'm Genevieve Glass.
Earlier today, I took a look at the dramatic drop in the stock market and how it relates to coronavirus. The coronavirus is not only impacting people's health, but also their wallets. Let's take a look at how the virus has hit the United States stock market in this by the numbers. Just last week, major indices like S&P 500 and NASDAQ hit record highs. This week, it's a different story. According to CNN, in just 10 trading sessions, the Dow went from all-time highs to a correction today, which means that it's fallen 10% from the recent high. More specifically, the Dow fell close to 1,200 points today and lost more than 3,200 points over the past week. It's on track to be the worst week since the 2008 financial crisis. In fact, more than $1 trillion in stock market value has been completely wiped out as a result, and many are attributing the fall to coronavirus fears. Companies like Apple and Microsoft are down 6.5% and 7% respectively because of supply disruptions in their products made in China. Investment bank Goldman Sachs went as far as to predict that American companies will likely generate no earnings in 2020 due to the virus.
USC students abroad are living day to day, knowing they might have to return home at any time. Sophomore Faith Bonds is studying in Paris and struggling with the uncertainty.
So USC has sent emails out to all study abroad students saying that if there is a CDC level 3 CDC level 4 or a State Department level 3 warning that we're going to be required to come home. I had 10 days of my spring break blocked out to go to Italy. So now that's out the window. So just knowing that my semester could be cut off at any point, my experience abroad could be completely stopped because of this epidemic is really scary.
Another USC student studying abroad in Florence has left and is now in Manchester, England. She's unsure if and when she will return to Italy.
I ended up talking to my parents. My roommates just got back from Milan from the weekend and they freaked out, and they told me to change the flight. Right now I'm in London, and these are my plans to be in London for the spring break. We'll see. Happen, and any minute now, they could also just tell us that it's canceled. No one knows what they're doing.
To students, the USC provost said, quote, "If you are studying abroad in an affected area and wish to voluntarily return home from study, please contact your program administrator and COVID-19 hotline at 213-740-6291. Officials say the university will support students' travel needs and discuss academic continuation options in each of your individual cases. The USC Health Center is ready to support returning students with proper medical care, but suggests students on campus take precautionary measures.
In many cases, the travel restrictions are both because we don't want people to get sick, but also because we don't want individuals to be in a country now where they can't get back. your individual personal risk is very low. It's much higher from the flu. We're working really hard to make sure that we're screening individuals who are returning from travel and are connecting them if someone that might be at risk, that we get them to appropriate testing and medical care. We've not had anyone who has been subject to any kind of a quarantine or self-isolation order, but we're prepared to support that.
Mayor Eric Garcetti is taking extra safety precautions after authorities confirmed a flight attendant who worked flights out of LAX contracted the coronavirus. On Wednesday, he said that the city will be disinfecting the airport every hour. Regardless, some USC students and staff are still canceling their travel plans.
I'm supposed to go on a cruise to Italy, but Italy's on lockdown. So that's the thing. And also all my family members in like the Philippines, stuff, I can't visit them anymore.
My grandparents, they were in Hong Kong on a cruise going through like that whole area, and they had to like completely cancel it when they got on the boat like a weekend and had to like get off it and fly back home, and completely got refunded and stuff. So
like the Marshall School of Business had to cancel all global trips that are supposed to be in March and in May. Usually these global trips involve students, like taking them to different countries to learn about global business and how business happens in different countries, which again, we're canceling that, unfortunately.
The university is advising students to pay attention to travel warnings. Students are being told to reevaluate any non-essential travel plans.
State officials are confirming a Northern California woman is the first in the U.S. to contract the coronavirus without knowing how she became infected. Governor Gavin Newsom gave an update this morning.
The case yesterday, understandably, generated a lot of attention, but didn't surprise any of the folks standing to my left or right. We knew this was inevitable as it relates to the nature, the epidemiology, the nature of these viruses. As of today, at this hour, we have 33 confirmed positive tests for the virus.
San Francisco, Orange County, and San Diego officials have each declared a local state of emergency to help with additional support and resources. The governor has not declared an emergency statewide, but is working with federal officials. Tonight, the White House says Vice President Pence is coordinating the government's response to the coronavirus.
Mr. President, as we've been briefed, while the threat to the American public remains low of a spread of the coronavirus, you have directed this team to take all steps necessary to continue to ensure the health and well-being of the American people. And the people of this country can be confident that under your leadership, we will continue to bring the full resources of the federal government.
Critics of Vice President Pence question his judgment on health issues. They say his refusal to start a needle exchange program when he was governor of Indiana contributed to the deaths of 200 people became infected with HIV. Annenberg Media will continue to have the latest information on the coronavirus. You can stay up to date at uscannenbergmedia.com.
The U.S. Department of Education announced today that USC will be subjected to 3 years of federal monitoring. This is because of the university's failure to respond to allegations of sexual misconduct against former gynecologist George Tyndall. Betsy DeVos, the U.S. Secretary of Education, said in a statement today, quote, "This total and complete failure to protect students is heartbreaking and inexcusable. Too many at USC turned a blind eye to evidence that Dr. Tyndall was preying on students for years." The university also released a statement to ensure that USC will improve its policies and processes to fully comply with Title IX. President Foltz said, quote, "There is no higher priority for me than protecting the health, safety, and well-being of our students, faculty, staff, and patients. I will continue to work diligently to restore trust in this institution and build a strong foundation of integrity and accountability." Under the new resolution agreement between USC and the Department of Education, the university will have to ensure its Title IX office monitors every complaint.
The university will also have to provide a review of every complaint to the government and review current and former employees to determine if they took appropriate actions after receiving complaints. Now, Chace, I'm really happy they're taking the necessary steps to make sure us students are feeling safe here on campus.
Yeah, I completely agree, and I just hope that this is another step in the healing of any students affected by this case.
Absolutely.
Thank you so much for watching See It Live, and from everyone here at Annenberg Media, I'm Chace Beech.
And I'm Brogan Kroener. You can watch us on the web at uscannenbergmedia.com.